Health news now at 5. This is Breast Cancer Awareness Month. The disease claims the lives of more than 40,000 women in the U.S. each year. 200,000 women are diagnosed with it. But within the past year, there have been conflicting reports about mammograms. Who should get them and when? 8 on Your Side medical reporter Susan Shapiro is here now with more on the guidelines.
There does seem to be a lot of confusion, especially in the past year or so. An independent government panel in the United States, it's the United States Preventive Services Task Force, issued controversial recommendations last year. It says women between 50 and 74 only need mammograms once every 2 years, and women in their 40s do not need routine mammograms, and that there's no need for self-exams. Some patients and doctors are unsure just what advice to follow. Dr. Nitin Tanna is here. He is in charge of breast imaging at Lancaster General Health, and we thank you for joining us tonight. We appreciate it. There is a lot of confusion. Are you finding that from your patients?
I totally agree with you. There's a lot of confusion both among patients and among doctors. The controversy over mammography has been present for decades, and every 5 to 7 years a new study comes out with a different set of recommendations. The Preventive Service Task Force issued some guidelines essentially that have raised a lot of controversy. We still use mammography as the critical screening point for detecting early breast cancer.
I was going to say, and how does that work? A lot of people might not know. It's what you see on the mammogram that gives an indication of cancer or that there is a normal mammography?
Correct. The mammogram is in fact an X-ray image of the breast. So essentially a very low dose X-ray it's a very low dose of radiation that is utilized to do a two-dimensional image of the breast. The current standard in vast majority of places, and certainly at our facility, is digital mammography. And so we look at these mammograms and we look for certain peculiarities in the normal architecture to try to detect early breast cancer.
And what about women who may be at higher risk, say it's in their family or they're concerned? Should they have mammograms in their 40s?
The recommendations at our institution, and also supported by a number of physician organizations, including the American College of Radiology, American College of Surgeons, Obstetrics and Gynecology, Society of Breast Imaging, Susan Komen for the Cure, I can go on and on, all recommend annual screening mammograms for women of average risk starting age 40. For the woman that is at a higher risk, there's a more aggressive screening that needs to be performed. This includes genetic testing, more regular physical examinations of the breast. In those women that have a greater than a 20% lifetime risk of breast cancer, breast MRI should be supplementing the mammograms.
So am I understanding that right now you're not going along with what the task force is saying, that you're recommending that women should have annual mammograms beginning in their 40s?
That's correct. All of the recommendations issued by the task force, including annual examination of the breast by a physician, monthly breast self-examinations by the patient, and an annual mammogram still remain as they've always remained. There's overwhelming data to support that mammography saves lives, and we need to continue what we're doing despite these studies.
All right, and can you ever get a false reading where then you have a biopsy and it turns out to not be what you thought it might be?
Correct. Mammograms have approximately an 8 to 10% false negativity. Their abnormalities can be missed. On average, 10% of women in the United States that undergo screening mammography are recalled for additional evaluation. Vast majority of those can be shown to have absolutely nothing wrong on the additional evaluation. A very small percentage, maybe 5 to 15 out of 100 women, do require additional biopsies, and even those, a small percentage will actually have cancer.
All right. Well, thanks so much, Dr. Tanna. We appreciate you being here and clearing it up for folks. Very informative. Thank you.
Thank you.